Alright, here's our subanatomy preview for the Bisection Nasal Cavity Palate Lab. Where we left off last time, we had exposed the pharynx from the back, and so we're going to pick up from there. The first thing we're going to want to do is we're going to take a blade and section through the pharynx right down the middle, and then we're going to sort of pry this open and look into the pharynx from the back, and what that's going to allow you to see is basically the oral cavity from the posterior. So you can see the surface of the tongue, you can see the uvula, and if you get into that space you might even be able to see some teeth. It's pretty tight, pretty small space, but take a moment and check that out. You'll be able to identify structures like the epiglottis. This will be really obvious from the posterior. So have a minute, cut through this with the posterior wall of the pharynx with the blade in order to get into this space and see these structures. Alright, then we're going to do a bisection of the head along the mid-sagittal plane. We want to be just barely off the midline, so I would say try for the midline and you'll end up right where you need to be. The cuts through the occipital bone will probably be easiest with an electric saw. And then likewise, if you have a lot of frontal bone, you might want to use an electric saw on that. That's really hard bone. And then you'll want to switch to a long saw when you get to the cranial base. This bone is relatively thinner and easier to cut through in a straight line with using a long saw. So we'll want to do this in sort of two stages, to do the frontal and do the occipital. And then when you get to the cranial base, you'll want to cut through that along the midline with the long saw. And we'll go all the way through the palate, and then when you get through the palate, the head will split into two sides, and then you'll want to cut through the tongue using a blade. And then we'll leave the mandible intact today, and then we'll deal with that, separating the mandible, next week when we do the oral cavity dissection. So that's going to be the full extent of those cuts. When we get it cut, we're going to split the two halves. Both will remain attached at the viscera, so it's not going to come apart like it will here in the figure. But the key here is that we really are working with two views. Hopefully on one side you have a pretty good view of the nasal septum, where you can see the mucosa of the nasal septum there. And then if we turn around to the other side, we will see that the other side has no septum, and thus we're looking directly at the mucosa of the lateral nasal wall. So we want to be able to recognize both, see both, look at the tongue in section, look at the palate in section. This is sort of the first step, is just to sort of recognize how did I divide this, how did it go. But let's turn to the side with the septum on it and do some landmarks. So some of the first things you should be able to identify, the maxillary and palatal components of the palate. You might be able to see a suture line that separates them. The mucosa of the nasal septum, and then the sphenoid sinus. You should recognize that as usually a pretty big sinus that's just inferior to the sella turcica, or the hypophyseal fossa. So have a look, find those basic landmarks, get your bearings before you start taking this thing apart. The next structure we want to find on this side is we want to find the nasopalatine nerve running along the nasal septum down to the incisive foramen. Chances are you won't be able to see the incisive foramen as it is here as a canal, but if we work carefully through the mucosa and look just in this approximate line, we'll be able to see the nasopalatine nerve, and you might be able to just pick the mucosa away in order to expose that nerve bit by bit. Now remember, this nerve actually came from the sphenopalatine foramen, which was on the lateral nasal wall. So what we'll be missing is this part of its course, because it started over here from the lateral nasal wall, from about this pterygopalatine fossa, went through the sphenopalatine foramen into the nasal cavity, and then down the nasal septum. So we won't have this part of it, but we're going to search for this portion of it as it sits between the mucosa and the bone. Now if this one doesn't work out, you can't find this one, you do have another option. You can peel the mucosa off completely from the bone and then chip away the bone to find the other side's nasopalatine nerve. So you have two opportunities to look for this nerve. Then once that's done, you want to take the nasal septum and cut it off from the inferior and then flip it upwards. So it's basically like a convertible lid that you can flip up from the bottom upwards, leave it attached on the top, and this will give you enough of a view that you can see the three nasal conchas in a row, superior, middle, and inferior. Some other sort of basic landmarks in this area, especially if you remove mucosa from this area right in front of the sphenoid sinus, you can find the sphenopalatine foramen. And this might be easiest to identify because you'll have a small artery coming through here that will probably be cut straight across, so you'll see the open lumen of that artery. It's a relatively small foramen, but let's see if you can find that. And then another, let's see where we're going next here. Yes, the more posteriorly, if we get to the nasal pharynx, that's where we're going to have the pharyngeal opening of the pharyngotympanic tube or auditory tube, or eustachian tube if you like. That's going to be a very obvious hole in the lateral wall of the nasal pharynx. And then the ridge that is right above that, it's like a ring of cartilage over the top, is called torus tubarius. So these are just, again, some basic landmarks to get your bearings on this space, figure out what everything is before you go any further. All right, then let's turn to the other side, because you could identify all those same structures on this side. You got your conchas, your sphenopalatine foramen, your auditory tube opening. But on one or the other sides, and it's probably going to be easiest on this side, we're actually going to cut the conchas off completely in order to expose the spaces beneath them. The interesting thing about these spaces underneath each concha is that these spaces give access to the other paranasal sinuses, as we talked about in lecture. So if we cut away the inferior concha and you pass a probe or a wire into the hole that's right about in this position, that will connect us up to the lacrimal fossa, and we'll be able to establish the continuity of the nasolacrimal duct. Likewise, underneath the middle concha is this space called the middle meatus, and there's an opening in here that opens into the maxillary sinus, and it's a relatively large semicircular half moon shaped, sort of arc-like shape to it, so we call it the semilunar hiatus. And then there's an opening at the back end of that goes to the maxillary sinus, and there's an opening at the front end that actually connects all the way up to the frontal sinus. So you might be able to pass a wire or a probe through and establish that connection. So just the middle concha and the inferior concha, we're not going to do anything with the superior. That's usually pretty low yield. And then I would also recommend on this same side, go ahead and remove all of the mucosa from the surface of the lateral nasal wall, so you can see the bones and that you can clearly visualize the sphenopalatine foramen. It's really important that you can see this in order to do the next set of steps. So I'm going to show you the next steps on the other side, but it might make more sense for you to do these on the side that you've done the opening. One step I'm not going to show you, I would encourage you to do this at any time on one of the two sides of the body, is to actually cut open the maxillary sinus really wide. Cut a huge square out of the lateral nasal wall so you can get your fingers into the maxillary sinus, and try to feel for the tooth roots, because these tooth roots often project upwards into the maxillary sinus and are easily palpable from within. So this is kind of a good moment for a dental student to be able to feel tooth roots from within the maxillary sinus. Okay, so returning to this discussion of sphenopalatine foramen, assuming all of this mucosa has been removed so we can see the bone, we can see the sphenopalatine foramen. If you pull down the mucosa off of the palate, and this is really tough to do, so I will caution you, this is a hard one. Peel this mucosa down. It's very adherent to the bone, so you really have to force it. You'll be able to find these palatine nerves, the greater and lesser palatine, lesser to the soft, greater to the hard palate. And these are branches of V2, as you know. and which would come from this space right behind the sphenopalatine foramen. So if I can visualize where they emerge here on the palate, and I can see about where they would have started here, you can actually use a scissor and just chip out bone along that path and expose the palatine canal. So I'll just sort of try and visualize that by pushing the bone away, and you can see the vertical portion of the lesser and greater palatine nerves. They'll look something like that, sort of slightly angled, but mostly vertical. And then the last set of steps we're going to do is we're going to look for muscles of the soft palate. There's two that are above the palate and two that are below. Two that raise and do raising-like functions, and two that do lowering functions for the soft palate. The upper ones are called tensor and levator villi palatini. These are, like, if you peel the mucosa off of this surface, if I go back one step here, this was the pharyngeal opening of the auditory tube. If I peel this mucosa away from here, then I'll be able to see this muscle here, which is the tensor villi palatini, and then the levator is right next to it. It's not shown here. At the same time, the other two muscles can be found below, and you might be able to see sort of a ridge located right about here, and maybe a ridge located right about here that is coming down from the palate. Sometimes that's hard with these fixed cadavers. The tissues have been pretty compressed. But if you peel the mucosa away from this surface and peel the mucosa away from this surface, you'll find these relatively small muscles that are coming down from the palate. One that goes to the pharynx, palatopharyngeus, and one that goes to the tongue, palatoglossus. And these are very small muscles. We're talking a few muscle fibers and no more. So that is the extent of our work. Get through that bisection quickly, because there's a lot of odds and ends to this dissection, so you want to give yourself plenty of time for that. But this is a big day for those of you who are afraid of V2, because you're actually going to see a lot of those branches today. All right, that's all I got for you on this one.